Good afternoon, ladies and gentlemen. I'm coming to you from the headquarters, White Sands Missile Range building in our garrison area. Thank you for joining me this evening and look forward to providing you an update. I understand there was some confusion about the numbers that I provided yesterday in regards to the cases in the area. They were based on the state reported numbers, and the news had come out with numbers as I talked. They were more updated. And so today I will share with you the numbers that the news is reporting on cases both in New Mexico and in El Paso. And the numbers that I've got, and we're speaking to you just before 4 p.m. or 1600s on Friday the 20th of March, are 43 cases in New Mexico and 6 cases in El Paso. Of those, we are tracking 2 in the local area, both of those being travel related. What do I mean travel related? By travel related is someone who was in a place where COVID has got an outbreak. And so whether that's one of the epicenters in the United States or overseas, that's what we mean by travel related. So at this point, we're still tracking, even though the numbers are going up, that they are in the local area related to folks' travel and not community transmission of COVID-19. So one update for today, I told you that there was an exception to policy that had been requested for the AI-AMD test. And that exception has been approved, and the numbers continue to be focused down on how many outside folks are needed to be able to actually conduct that test. The battalion that will come from Fort Bliss, which is really the unit under test and will be doing the training, is going to go through all of the pre-screening and quarantine any individuals that we would quarantine. And so we're maximizing and ensuring, maximizing your safety and ensuring that the same standards are applied to be able to protect the health and welfare of all of our folks. Now on to today's questions. The first question is, I'm a proud working mom with the privilege to telework. However, I am not authorized to care for my children and claim I worked at the same time per the telework training. I have no issues with this guidance as I leave my small children with the amazing daycare on post. However, I am hearing that more and more parents are teleworking and taking care of their children during the same 9 hours. Has something changed in the guidance? The guidance has changed, and the guidance, DOD has provided an exception to that policy that prohibited having children in the house and no one else caring for them while you telework. And that exception or waiver has gone into effect and continues through the end of this calendar year. And really what that waiver says is you can telework with children in your home, but essentially you've got to ensure that the amount of time you work is what you're getting paid for. And so if taking care of your kids takes 2 hours out of that 9 hours, you've got a choice. You've got to work those additional 2 hours or only claim the 7 hours that you actually worked. And that is the guidance so that the government is paying for the work that you're providing, and at the same time we're maximizing your opportunity to be able to take care of what you need to take care of in the current circumstances. The second question, is there any talk about going to administrative leave as programs continue to fall off the schedule and virus numbers increase? If so, for how long? This is where we're really, the phrase maximize telework is intended to say what are the current circumstances and what is needed to be done at the workplace versus what can be done elsewhere. And so right now there is no anticipation of using administrative leave, and in this case it would be weather and safety leave that you would be talking about because of where we are in terms of conditions. If the work is such that the nature of what you're doing isn't normally able to be done via telework, but there is an opportunity when that changes, engage your supervisor and have the conversation to see what opportunities are available. And that's really the way to move forward. Are there other potential moving forward? If the disease changes in terms of the spread in our local area, we will continue to reassess this as those conditions change and guidance changes. So those are the questions for today. We had a long discussion, and really that brings me to a point before I get there, which is you see me, and you see me as the face answering your questions and providing updates. And I am privileged to lead the workforce and the community here, which has got an incredible amount of true professionals and outstanding citizens that make up this community and workforce. Part of that is what makes it so I don't look bad when this happens. And so that's the preparation and actually the videoing of what goes on here. And so today's shout out is for the team that's really prepping and helping me answer your questions, and then getting this to where you can actually view it. Now, moving forward, there's the question, hey, are we going to do this over the weekends? Understanding that we need to take care of the workforce, and that includes maximizing opportunities to recover, and that's the weekends. I am not going to do this in the office or bring folks in the videotape over the weekend. What I am going to do is we'll go to a different solution and probably a much shorter presentation where I'm addressing you and can do it essentially from my personal device, and we'll upload it. So the quality will be a little bit different, but that way there's no assumption that no news is good news or no news is bad news. My intent is that we have something up by 5:30, 17:30 in the evening, both Saturday and Sunday, so that you know what I know at that point in time as we move forward. Thank you for continuing to view and provide feedback. I look forward to your questions, and we will continue doing this as long as it makes sense, and appreciate the efforts of everyone taking care of yourself, your family, and also our community on White Sands. Thank you, and have a great evening.